First of all, thanks everyone for joining our Pacific Digital Health webinar series. And again, thanks to DFAT for supporting this under the Partnerships for a Healthy Region initiative. Today's session focuses on recent features in Tamanu that you might not know about. As I'm sure you know, Tamanu is an open source electronic medical record, and it's currently being used or implemented in 8 Pacific Island countries. So when we first deployed Tamanu, there's typically a lot of excitement around what it can do, and it often represents a major step forward for digital health systems, workflows, reporting, and patient care. But one thing that's important to remember is that the software is never really finished, so it's constantly evolving over time. And over the years after the initial Tamanu implementation, we make a huge number of improvements and new features, but they're not necessarily implemented and people may not even know that they exist. So this is a real challenge that we see with existing and long-term deployments. So today's session is intended as both a bit of a practical showcase of some of these features and also a conversation starter. We really want to explore how we can do a better job of continuously rolling out and embedding new features over time, safely, sustainably, and at low cost. So maybe that's through something like an annual seminar or trainings led by local teams or some other approach that we haven't thought of yet. So we really want to hear your ideas about how we can best achieve that. So please put those ideas in the chat or reach out to us later. The format of today's session is intentionally going to be pretty fast-paced and lightweight. So you'll see 10 recent features in Tamanu, and each is only going to get around 4 minutes of airtime. So we're really just going to be skimming the surface. So the context, what it does, and how it works. And in reality, every feature that we're showing today could probably deserve its own 30-minute presentation. So if you do have questions, please pop them in the chat. And if anything jumps out that you think could particularly help your team or improve local workflows, then please do reach out to us afterwards. And we'd be very happy to go into more detail about any of the things that we're showing today. So with that, we have 2 presenters today that are going to take us through the top 10 recent features in Tamanu. We have Corinna Minko, who's a Senior Project Manager at BES, and she's worked in Tamanu implementations and digital health across Nauru, Samoa, Tonga, and Fiji. And we have Dr. Michael Nunan, who's the CEO at BES, and he's worked in digital health and health system strengthening across the Pacific and globally, and he continues to play a really active role in the day-to-day development of Tamanu. So with that, I will hand over to Michael to start us off with our first feature.
Thanks, Sam. And can I say how happy I am that we are still using a 10-year-old photo of me? I think that is the 10th anniversary for that photo, and I got to say, I looked a lot better back then, but that is fine. So as Em said, hopefully this is going to be a bit of fun today. Me and Corinna will be going back and forth, and I need to set my own timer. So I'm going to do that now so that I don't run over time. Each of these only gets 4 minutes. So I'm starting my clock and starting with the new medication module. So Tamanu's always had basic medications in it, but it is now a fully fleshed medication module for managing both ongoing medications and in encounters. So I've clicked through here to a patient's profile, and we can now go and look at their medication tab. And you can see that this patient, myself, has 2 ongoing medications, and I can see previously dispensed medications here. Now I can add ongoing medications here, and it will show me any allergies that are relevant. It will show me all allergies. It's not showing specific to a medication. It also doesn't prevent you from prescribing the medication if you do have an allergy to it, but it's a really prominent display right above the medication that you're selecting. Once you've prescribed a medication, it will appear here as an ongoing medication, and from here you can send it straight to pharmacy. So I'm going to send that Perindopril down to the pharmacy. I'm going to ask for 30 of them, and away they go. It also manages the number of repeats that you have left. And then you can admit someone into an encounter. So we're going to create a hospital admission here. Just going to admit this patient so that you can see what that looks like. And once you've done that, within the encounter, there's an encounter level medication module. Now, because this patient has ongoing medications, We want to avoid the prescriber having to type them all out again every single time they have an encounter. It's slow and it's really prone to errors. So what we can do is import existing medications. They can review them and then confirm them. Well, I've got to do a discharge quantity. They can just make that up. They can also put 0 if that's not going to be on discharge. And then with, other than the entering the quantities, with 2 clicks, that patient's existing medications have been brought into the encounter and away you go. We also have a medication administration record. Now, this is blank because I've just admitted this patient, but if I come back here and look at Eugenia Bozeman, who had an existing encounter, and go to her medication administration record, or the MAR, it's also digitized to paper administration records that circulate around hospitals and that clinicians are constantly chasing each other for. So you can see here medications that were previously given, medications that were missed. And because I gave this one out of time, it's even got a little alert next to it. And I can click onto that and I can see everything about it, who recorded that, what the status was, whether there was a medication alert attached to it, all those sorts of things. And I can also get a bit of decision support over here on what future doses are coming up. When a medication is due for administration, it will also appear in my tasking dashboard, and Corinna's going to go through tasking next. And you can see all of these automated medication due tasks have appeared. And when I send a medication to the pharmacy, we also now have a dispensing module. So from within the dispensing module, I can see earlier I sent the acyclovir, and now that perindopril that I just sent through has come in. I can click on that row. It will pull up everything that has been ordered for that patient. I can adjust the instructions or I can leave them. And you can see there that it gives me the labels, and I can dispense and print. If you have an integration with M-Supply, once you've done that, it will also send that transaction to M-Supply so that your inventory system keeps track of the stock that you've got. And if you've got an integration with Open M-Supply, when you are prescribing a medication for a patient, so back here in the encounter, if I'm prescribing a new prescription, it will show me the stock on hand as I go to prescribe it. So if I click here, and it knows, it will show me that there's 122 of those in stock at the moment, and that is pulling in near real time from M-Supply. The final thing is when I'm doing a new prescription, you can also prescribe medication sets. So for example, with Helicobacter pylori, if I'm always prescribing the same thing, again, it will suggest to me what to do, and just with 2 clicks, I can finalize it and prescribe those 2 items. And you can do that with completely configurable, whatever the clinicians want. I've run over time. Corinna, over to you. You're on mute as well.
Yeah, thank you. Chugging on my screens. All right. As Mike suggested, I am going to be looking at tasking. So tasking, as the name suggests, allows a task to be created and assigned to user designations. And it's designed to help keep track of important clinical tasks that should be carried out through a patient's stay. So things maybe like changing a dressing, conducting a post-op assessment, or changing a patient's bedding. So tasks can be found and added from the encounter level under the tasking tab by clicking on new task. You can add tasks as a set or individually. Adding tasks as a set automatically assigns, similar to the medication set, a number of tasks that are pre-configured in terms of their frequency and who they might be assigned to. So again, in one click, I can add all these tasks that are associated with that post-op assessment. If adding a task individually, then the user would have to assign, if relevant, the frequency, if it's a repeating task. So, every 4 hours, the duration, and select a designation who that should be assigned to. Should it be doctors, nurses? If that's left blank, it'll appear on everyone's work list. And so once we've added some tasks, they'll appear here on the encounter level task table. By default, we are showing all the tasks due for this patient in the next 8 hours to sort of replicate the standard shift length, but that is configurable to a deployment. When it comes up to updating the tasking table, we've got 3 statuses that we use to track these tasks. So we have to do, which is those that still have the dotted blue circle, but we can come in and mark these tasks as completed or not completed as they are done. And so by marking them as completed, can leave a little note. It records who's completing that and at what time. The exact same if I were marking this as not completed. And you'll notice as I'm doing that, those tasks start to drop off the table for this patient. I can always bring them back by clicking on these 2 showing completed and not completed tasks here as well. If I filter over the tasks, it will show me who's completed them, what time as well, give me that level of information. Now that's looking at tasking at our patient level, but what's also really neat, and we saw it for the medications, is that all those tasks will also come through into this clinician's dashboard. So if I'm logging on at the start of one of my shifts and I sort of need to have an idea of what's coming up for me this day, all of those tasks are going to appear here. Now, at the moment, I'm looking at every single area in the hospital. I might just be working in Ward 2 for the day. And so if I filter my list, it will show me my patients in Ward 2, any upcoming tasks I have for those patients, and I can click in and it will take me straight to their tasking table where I can start to manage those tasks. So that's a really quick overview of the tasking feature. And I'm going to hand back to you, Mike.
Thanks, Corinna. All right, let's come back to my screen. I am going to be showing you notifications. So within the clinician dashboard, which is your basic landing page for Tamanu, you can see recently viewed patients, upcoming tasks. You can see your appointments and your bookings for the day. And you've also got a little notifications bell up here. So within the notifications bell, it will send events that have happened to you and bring them to your attention until you read them. Now you can see recent notifications over the last 48 hours that have been read. After 48 hours, they will clear from this screen, but they won't clear until they've been read. And so here at the top, you can see unread notifications that are waiting for me. And I'm going to show you 3 ways that notifications will ping. Firstly, again, coming back to Eugenia, we can order a lab for her. Now, she's got lots of labs in here. I'm going to do a new one, just the most basic lab test that I can do, which is a COVID sample. So we go to COVID swab, send that off. We'll say when it was collected and finalize it. I'm not going to put in any of the other details. As I say, it's not a demonstration of that. But once this is received, if COVID swabs are still being sent off to the lab, they come into here and they can enter a result against that. And they may enter positive or negative or inconclusive, but let's just say that she's positive. And usually this would happen automatically in the lab in an integration with the LIMS, but they can also do it manually. They can publish that result and away you go. So the COVID-19 swab that I ordered for Eugenia is published. Now, while I'm still here, I'm also going to do an imaging request. So I can send her down to the imaging department, down to radiology, and get a request for an X-ray on her ankle and finalize that. And when she gets down to the imaging department, they can click onto here and they can say, okay, that's completed. No fracture detected. Save. And within her medication module, pharmacy may come along and look at her clarithromycin and say, the dose seems too high, please review. So put a pharmacy note on her. And this is obviously happening across all sorts of patients. Back in my dashboard as the clinician, I don't want to be going back and checking every individual patient that I'm managing for the day to see if tests and results and everything have come through, but I can just check my notifications. And here you can see the pharmacy note, the imaging results, the lab results for Eugenia are now all available. And by clicking on the notification, it will take me straight to that imaging request and I can see the result. It was completed and no fracture detected. I'm not having to constantly cycle back to patients during the day. And similarly with all of these, that's now marked as red, but I can similarly go and look at lab results for myself. It will take me straight to that COVID-19 swab for an earlier one that I did for myself. I can see that that was published and the result is positive. Bit of a COVID outbreak in this hospital at the moment. Similarly with the pharmacy note, if I click on that, it will take me right to that prescription and I can see the pharmacy note. So I'm not spending all of my time clicking around. And finally, if I've got a lot of notifications and I'm actually aware of them and I don't really need to click into each one of them, I can just mark them all as red. And so by doing that, the next time that I come back to it, didn't take, there we go. Next time I come back to it, it's marked as red and it will disappear after 48 hours. So that's tasking, and we've actually got plans to add quite a few more. Sorry, that's notifications, and we've got quite a few plans to add notifications into that module as well. Back to you, Corinna.
Thank you. All right. I'm going to take you through our disease coding workflow. It's something that we've put into practice a little bit, but not many of you might be aware that we are able to do it. So we introduced a new type of reference data, which is disease coding, and it's a specific type of reference data usually linked to the International Classification of Disease, or ICD-10 coding. It's different to recording a diagnosis against your patient. And the idea behind it is to separate the diagnosis from the disease coding. So a diagnosis, as I've just added here, is a separate list and it's used for the clinical identification of a disease or a condition, whereas clinical coding is the translation of that health record, so things like our medical diagnosis, procedures, other relevant clinical content, into standardized codes. And the idea behind sort of separating these was to separate them not only practically, but within Tamanu and the way we can record them. Previously, we had quite a bit of overlap in our diagnosis field. And as we're moving towards using the SNOMED CT in this field, the medical coding reference data, was created to allow that coding to be done properly using ICD-10 coding after an encounter is closed. So the way we can do that, different to adding a diagnosis, it's recorded under a form. So under the patient, we can introduce these medical coding programs with a medical coding form. It's really nice and straightforward. So you would simply enter, the medical records team or the medical coders would come in after a patient's encounter, review the information, enter the date of the encounter and the date of the coding, and then they would come in here and can select one or more relevant ICD-10 codes related to that patient's encounter. They can add any additional notes as well that might be relevant to that coding. And by submitting that form, we've now recorded that coding data against this patient, and that can be used in reporting, to PIA visuals, all of that kind of thing as well. So a really simple couple of steps, but really important in separating that diagnosis from medical coding. So nice and short, and back to you.
Thanks, Corinna. I forgot to put myself on mute then, but luckily I didn't say anything. So now I'm jumping around. This is chaotic. There's so many features we're going through, but hopefully people are keeping up. The next one I'm showing you is charting. So if we come back again and look at all patients and navigate back to poor me, who is still in my encounter, you've always been able to record vitals in Tamanu, and obviously always able to record notes. And there's a few ways of capturing data against the patient, including program forms. But now you can do charts, and they're really, really highly configurable. You can have as many different charts as you like. Here you can see that I've been doing a pain assessment over time for this patient. And I'm going to record it again right now. So we'll say that the pain is still in the right knee. The pain intensity is getting worse. The pain is now a stabbing pain, and it's constant. And so you can see here that that pain is deteriorating, and you can keep capturing that data over time. To do a new chart, you can come into here and, for example, do what we call a complex chart, where the patient may have a wound assessment and you need to define where the wound is. Now, if they have multiple wounds, you need multiple charts, and that's what we've set up here. So they have wounds on their right knee and on their leg, and you can add more so that we can say their left hand, for example, and you can say it's a traumatic wound. And then against that particular one, you can capture information. And again, it's all completely configurable how you set this up. So it's a 4 centimeter, 7 centimeters long. Wound depth is 0.5. Pressure off the grade. And you can actually attach images now. I haven't set this up to attach images, but you can, and then you can capture the date of that. So that you can see there that their left hand status, and you can track that over time, but you can track that separately to the right knee. And there's all sorts of different charts that you can set up in there for patients. This is just some examples. Now, that's really, really useful for an individual encounter, obviously, but there are some charts, and wound care is a good one, where you want to do charting over time and across multiple encounters. And so you would do that within a program registry. So if this patient was going to be coming back in to get wound care, you would add them to the wound management registry. You would come into here, and then you would click into here and see their charting over time. So again, this patient was added to the wound management registry, and we can record all the same things. I'll just go as quickly as I can here. Just skip the rest of the questions. And you can capture that over time across multiple dates, across multiple encounters, and you can come back to this patient's dashboard for wound management and see all of that charting over time. And the advantage of that is that if you do have a complex patient, be it for diabetes, antenatal care, wound management, whatever the case may be, you can keep coming back to here without clicking into every individual encounter to see the relevant data associated with them. And that builds up over time for each of the patients. Back to you, Corinna.
Yeah, getting a bit better at sharing screen on time. All right, I'm going to show some enhancements, some recent enhancements that we've had to the procedure module. So a lot of you are probably familiar with the procedure module. It's been in Tamanu since its launch, but recently there's been some really important improvements that are going to let us capture a lot more detailed information and sort of align with WHO standards for workflow management. So like I said, those of you who know the procedure module might already notice the changes that are in place. But if I start to record a procedure, so maybe a knee reconstruction for this patient, I'm now able to record the department, so which team is responsible for carrying out this procedure. The location and area, that remains the same as previously, but the clinician field has now been renamed to lead clinician to make it a little bit more clear. And this assistant clinician field is now multi-select. So again, just to allow for a bit more granular recording of everyone involved in that procedure. We now also have an assistant anaesthetist field. So not just recording the one anaesthetist, you can record all that were involved in the procedure. And also importantly, the time in and time out fields. So that's aligning with the WHO surgical safety checklist, a few more fields to capture the times when the procedures are starting, but also when the patient's coming in, out, and anesthetic and that kind of thing. But probably the biggest change is that we can now complete a form within the procedure module. So that's allowing us to collect a lot more detail about the procedure by filling in a form, but without having to go out of the module and click into the forms module and complete something entirely different. So you can see we can link forms to procedures. So to this knee reconstruction, we've linked the surgical preoperative assessment form. And if I select that, it appears just like a form, but again, it's just all within this procedures module. So I can go through and complete this form just like I would any old form. I'm going to skip through all the fields because I'm sure you all know how to complete a form, but noting that we can configure these forms as required by your deployment. So I can go through and submit my form, and that's then attached to this procedure. So again, I can see that form response within my procedure module here. So we can link more than one form to a procedure. So you might have another form that you want linked to this procedure type. And we can also link that same form, so this surgical preoperative assessment form, it might make sense to link that to every surgical procedure so that it can be completed within that procedure module for any procedure. So yeah, really nifty, really handy for recording more of that information all on the one screen, saving you from clicking around and jumping throughout Tamanu. All right, back to you, Mike.
Thanks, Corinna. Click on my share button. Now I feel like you're setting a standard that I have to absolutely meet. So if we come back, I am now going to show you the patient portal. This is one of our newest features, and it really, we hope, creates an environment where patients have far more autonomy and agency over their own medical management. Can you see my screen? It's not. Is that...
Yeah.
Okay. So sticking with me, we've now got this patient, and we can now establish a patient portal for them, which is a secure portal where they can see their own medical record and actually even interact with their own medical record. So if I come down here to patient resources, there's a ton of resources that you can create. ID cards, ID labels. We've now got a QR code ID, which didn't make our top 10 new features, but you can now create a QR code for patients and scan that QR code when they come back in. Birth notifications and an international patient summary. And down the bottom here, you've got patient portal registration. Now, I've actually already set myself up for this, but the screen looks very, very similar. Once I've registered for the patient portal, I enter my email into here and click send. Now, I've already done this because it takes a couple of minutes for that to arrive at the person's email, and I didn't want to twiddle my thumbs here in a 4-minute presentation. So I've already sent that a few minutes ago, but it's as easy as that. You register the patient in that way. And I'm now going to show you what that looks like when it arrives at the patient, which is this. So I clicked on the link that was just sent through to my email, and I'm now going to continue to log in. And in order to log in, I have to enter my email and send a verification code, like a lot of things that you see these days. That has come through very, very quickly because that is directly connected to the central server. It doesn't need to sync anywhere. We'll log in using my code. And here you can see my patient portal. Now, this is designed to be optimized on a mobile device. So it's a little bit wide here, if you can imagine that. Looking a bit better. I'm going to narrow my screen a little bit so that you see more what it looks like on a mobile device. But here you can see patient details. So these are my demographics. You can see ongoing conditions if you have any. You have allergies that are listed. These are planned procedures and completed procedures. You have medications, and you can see those 2 medications that we were looking at earlier. So these are the current medications that I'm on, perindopril and acyclovir. And you can see a record of any previous vaccinations that you've had and any upcoming vaccinations that are scheduled. You can also see up here, upcoming appointments, although I don't have any, and outstanding forms. So what do we mean by outstanding forms? What we can do now is send forms to patients. If I get my share back up. So now when I'm back at Tamanu, in the program forms, which a lot of you will have seen, I might want to send a new surgical consent form to a patient in advance of a procedure that they've got coming up. I can see the consent form in there. Let's go with immunization. So I might want to send an adverse event following immunization form to a patient after they've had a vaccine, so that we're asking them in a couple of days to report if they had any symptoms. And instead of me filling that in myself, I'm going to send it to the patient portal. Okay, so send it across. Now I'm just going to do a nifty trick on Tamanu to force it to sync immediately, because this needs to go to the central server and then it will arrive at my patient portal, which has now been sent off. Now you can send any form. It could be a consent form. You can send program registry forms, all sorts of things. And when you come back, and realize I'm hitting my 4 minutes, when you come back to the patient portal, and I share my screen, here you can see that has already arrived. So it's now telling me that I've got an outstanding form to complete below, an adverse event following immunization reporting form to be completed. It's really, really obvious. I click on that and then I can work through and submit that. Now, this is actually it's been a while since we looked at this form, and it's got a few things, but for example, it already knows my name. So our error messaging could be better there, but you can send any form, consent forms, previous information, allergies, and these sorts of things. The patient fills them in and away you go. You can fill in all of these things. Obviously, this is a level of complexity we wouldn't expect a patient to fill in, so we would be sending them a much simpler form. But once they've filled it all in, they complete it, and that's been sent off, and that will now populate their patient record. Back to you, Corinna. So yeah, the patient portal, as I say, is available to use now, and it's really secure, and we're hoping to build out the resources in it, so there's more and more information available to patients.
Cool. I'm going to take you into something a little bit different, which is the Tamanu admin panel. So it's a separate component of Tamanu that a lot of you might not have seen before. And it's where our administrators manage things like users, permissions, reference data, things that populate the front end of Tamanu. In recent releases, there's been some significant work to make the functionality of the admin panel much more user-friendly and streamlined. So if you have seen it before, hopefully you'll notice that these updates are gonna hopefully make a lot of difference to how easy it is to use. I certainly think so. So I'll just touch on a few of the updates. And the first one is under our user tab. We now have the ability to create and manage users directly in the admin panel under the user profile. So you can see here, this is our demo environment, and we've got all our demo users here. I can click into any one of these if I need to update their role, if they've changed their email, if they need me to reset their password. I can do all of that through here. Something that's also really nifty is that I can schedule leave for my clinicians. So if, for example, this clinician is going to be on holiday for the next week, I can pop that in here. And a little preview coming up, I'll be showing you the appointments calendar where that populates as well, but it's going to show on my scheduling calendar so that I don't accidentally book appointments for that clinician while they're on leave. So I can manage my existing patients, and I can also, existing users, and I can also add a brand new user directly here through the admin panel. I can assign their role. I can assign a designation, so that links back to their tasking table there. And I can assign their password. I can, if it's relevant, also assign which facilities they're allowed to log into as part of my deployment. It's not going to stop them seeing the clinical records from other facilities, but it will stop them logging in and, accidentally recording information as if they were working at another facility. So just like that, couple of clicks, I can create new users. Now, still under the user heading here, we can add new roles and designations. So a role is linked to your permissions, what you can and can't do in Tamanu, whereas a designation is specifically for that tasking and when we're assigning tasks. I won't go into this in too much detail. If you're already sort of managing this stuff, you'll be a little bit familiar with it. And you'll notice that we can now add a role directly from our admin panel or add a designation. So you used to have to import things. It's a lot easier to manage now. Again, still under users, we have our location assignment, and this is going to link back to the appointment calendar that I'll be showing you shortly. We can assign clinicians to certain clinics so that, again, they automatically appear in that appointment calendar. So you can see here we've got Dr. Emily Andrews. She's working in the dental clinic from 9 a.m. till 3:30 p.m. today. I might want to add another clinician to our other dental room, but they might have a different shift. They might just be working from 11 till 5. I can mark it as a repeating appointment. If this clinician is working in that same clinic every week, saves me from having to keep putting it in there. And so I'll show you in my next demo what that looks like, but it's going to populate my appointment calendar so that I know who's working there. So it just helps me manage sort of the workflow within my facility. The other really big thing that's changed in our admin panel is how we can manage reference data and permissions. So again, if you're familiar with it, you'll know the big import and export of Excel spreadsheets that we used to do to manage this. You can still do it that way. But now I think it's going to come as a relief to many. We can directly manage our reference data through the admin panel. And so reference data is essentially lists that populate fields and drop-down lists on the front of Tamanu. So for example, here I've selected the department reference data, and that's showing me the list of all the different departments I have in my hospital. Similar to our users, I can directly click on one if I want to update the name of a department, or I can add a new department directly here through the reference data. If I'm doing a lot, I can still import them through an import list. But again, I think it's a lot easier to come in and just see what reference data you've got in here. And lastly, I'll just jump to permissions. I know this might not be familiar to everyone, but basically in Tamanu, we have permissions that tell you what you can and can't do in Tamanu. Those permissions are linked to a noun, which describes a certain functionality or feature in Tamanu. And then for each noun, we have a list of verbs which specify what action can be taken, and it's usually list, read, write, create. Used to be a really big spreadsheet as well that we had to import and export, and you can still do. But now what you'll see is actually under each of my roles, so these are all the different roles that I can assign to my users. It's now a really simple checklist. So if I want my finance team to be able to see appointments, I can just come in here and tick these boxes. Similarly, if I don't think, let's just say admin should see appointments, I can uncheck their permissions there. So I'm going to leave it at that because it is quite technical, but if you are an administrator and you're familiar with this, hopefully it's going to make your life a lot easier. Back to you, Mike.
Thank you. Now I hear let me show you something different, and I raise it to this. This feature is a fairly technical thing. It's our sensitive facilities feature, and it's very difficult to demonstrate on the front end without a lot of clicking around. So Tamanu has a distributed data model, and what that means is that every single facility can run entirely independently using a little mini server at that local facility. And it then has two-way sync with a central server so that all patient data can sync in all directions, and patients can move around health facilities and their medical record is waiting for them when they arrive. So it's a really, really robust system designed for environments where you don't have necessarily very good internet, or internet might be on and off, but you do want patient records to be everywhere, one patient, one record. But there are some facilities that are so sensitive that we don't want that information shared. And an example would be an HIV facility. You don't want other people to be even able to see that they had an appointment at that HIV facility, because obviously if they had an appointment there, that implies that there could be a diagnosis, or at least they were screened for it, and we don't want that. So you can now mark some facilities as being sensitive. And for sensitive facilities, data will still sync down to them so that they can see the patient's record. But the data that is entered at a sensitive facility does not sync out to all of the other facilities, so that they can't see that encounter happened, and they can't see what happened during that encounter. Now, an HIV facility is just one example, but you might even wish to add private facilities into a public network. So say you've got 4 public hospitals and then you've got 1 private clinic, and the private clinic wants to be able to see what's going on in the public system. but they don't necessarily want their proprietary information about what they've done and what they've charged and all that sort of thing to be available to everyone else. And so you can set that up so that that data doesn't flow out to all of the other facilities. We are now working on, and hopefully launching fairly soon, what we call sensitive facility networks, so that you can have 3 or 4 facilities where the information syncs between those 3 or 4 facilities. And an example is the SRH HIV hubs in Fiji. There's currently 3 of them. They want to be able to see each other's data, but they don't want that to be available to other people. And that will also be possible. It's not the only security tool in Tamanu. Of course, we have roles-based permissions, and you can very, very tightly control what people can and can't see at a really granular level. But this was an extra layer of security for particularly sensitive facilities that was launched several months ago. We realize this is a complicated diagram, and happy to share it with anyone who's interested. But hopefully that makes sense. Back to you, Corinna.
Cool. I think this is our last little demo, and it's the location booking calendar. So it's a little bit different to our outpatient calendar, and for some of you, you might not be seeing it at the moment because it's hidden, but if it's something you're interested in, you can speak to your project managers, and we can make it available to you. So we find it under the scheduling heading, just like with your outpatient appointment calendar. But it gives you a little bit more flexibility in that you can book out a location so that only one patient can be seen at a time, or booked at a time, I should say, per location. You'll notice it displays the length of the appointment a little bit more accurately within the calendar. So this is a 1 hour long appointment, and it's booking out that whole block compared to these 30-minute appointments. And as you can see, we were just in the admin panel assigning locations to some of our clinicians. Their names are up the top here, so I can see if I'm managing appointments for the day, I can see who my doctors are that are working or who my clinicians are throughout the day. Another great thing with the location bookings calendar is that we have both this daily and weekly view. So for something like a dental clinic, you might be wanting to look at it from a day-to-day kind of granular level, compared to over here where we are able to book out beds for things like overnight stays. It might actually be more useful for you to toggle onto the weekly view, where you can see, so this patient's staying in for 5, 6 nights, this patient's in for 1 night. We've got a couple of patients coming in for sort of day stays. So a little bit more flexibility in how you can view and manage. And now again, we can actually assign which views these locations appear on. So your ward beds, you might only want appearing on the weekly view and not on the daily view, and your dental clinic maybe vice versa. We can assign that in the back end as well, based on what's useful to you. In terms of actually coming in and booking appointments, it's really, really useful. We have this book location button up here, which will open up our little booking panel, but I can also just click directly onto the calendar. So if I want to book an appointment for this dental room at 12 o'clock, I can click on the calendar. It's already pre-populating where I'm making the booking for. And you can see it's blocked out those times where there is already an existing appointment. So I can manage my patient flow a little bit better, trying to avoid double bookings, that kind of thing. I can select as many little time frames as I want. And again, we can configure what these standard appointment times are. I might just want a full hour or just a 30-minute appointment. I can assign it like that. Again, you'll see that our clinician field has automatically populated because we've assigned a clinician to this location. And then I can just come in and assign a few extra bits of information. Our booking panel's changed a little bit. There's a little bit more information you can add in here, such as additional clinics. Are they coming in for any procedures? And you can actually link a relevant encounter. Once I book that, it pops up here on the calendar. And again, if I booked it for the wrong time, really easy. I can just drag and drop that within the calendar now. So that's nice and simple. The last thing I'll just quickly show you is if I want to go and book an appointment today for our clinician, Dr. Lane, who for those of you that were just looking, I booked Dr. Lane for some leave on this date. And so you can see it will pop up here and give me a little note saying that this clinician has leave scheduled at this time. So prompting me not to book an appointment there. So yeah, a really handy feature. I think looks really nice, and something we can definitely set up if you're interested. So I think that's everything that we were demoing today. So don't know if it's back to you, Em, or if we're opening for questions.
Yeah, thank you, Corinna. Thanks, Mick and Corinna. And hopefully everyone has, learnt about some new features in Tamanu that they didn't know existed before. I think the questions in the chat have been answered, but if anyone else has a question, please do raise your hand or just come off mute, given we don't have too many people online. But yeah, I'll give you 30 seconds maybe to think about if you have any questions. And in the meantime, also, I think it's good to have a think about sort of coming back to the beginning of this webinar, how can we actually roll out these sorts of new features as they're being developed for existing deployments? If you have any ideas, we would really love to hear them. As I said at the start, it is a challenge to introduce these new sorts of features in our existing deployments. We'd be very keen to hear about any ideas that others have. Go ahead, Mick.
Well, I sort of want to flip the script a little bit today, Em, and we have a huge problem, as you alluded to at the start, in that a lot of our deployments don't use new features. We really, really struggle. Obviously, we can't afford to have project managers permanently embedded with ministries of health. And, I think we find that, steering committees tend to lose a little bit of energy after go live and, after something's been deployed and it's working really well. But we then struggle when we release a great new feature, whatever that might be, admin panel changes through to notifications or whatever, tasking, to get existing deployments to adopt them, because there's a change management leap that needs to be made. And we're really open to ideas on, well, how do we do that? You see this with all software. Whatever software you use, you're constantly getting emailed, are you aware of our new features? But with EMRs, it's particularly tricky because there's often hundreds of users that you have to bring along, and it's not a problem that we've solved. It's really, really hard.
Thanks, Mick. All right. If there's no questions at this stage, that is totally fine. Feel free to reach out to us if you have any thoughts or would like to go into any of the things that you saw today in further detail. And also keep in mind our next webinar, which is next month, is looking at the Tamanu M-Supply integration. I think Mick mentioned that in the very first feature that we saw today, but we'll have a whole webinar dedicated to that integration. A really exciting thing that's happened recently. So thanks everyone, and we'll close it off here. So have a nice day and we'll see you next time.